Joining me today is a New Hampshire State Senator, David Pierce. So, David, thanks for being here.
I love coming back and talking about the issues.
A couple things. I know that you're not running next year.
Right.
So I know that you're free to talk about whatever you want, but I also know every time I've interviewed you, you say what you think. So I can ask anything. So I may come to sort of some reflections at the end of the interview, sure. But right now I really want to talk about this last session.
Okay.
What are the chief things that you think got accomplished from your vantage point that affect your constituents in the Upper Valley and the state? And what things didn't get done? That you think really have got to be addressed next year?
Okay.
And it's open-ended, but it's a good place to start.
It sure is. Well, again, thank you for having me on. I always love coming and talking to you. It's always a really good discussion. The two big issues from this past legislative term were the reauthorization of Medicaid expansion and, of course, responding to the opioid crisis in the state. And we were able to reauthorize Medicaid expansion. And so that's good because 50,000 Granite Staters now depend on Medicaid expansion for their access to health care. And that is particularly important to my district in the Upper Valley because Dartmouth-Hitchcock, of course, is the largest employer.
You got Alice McDay
there,
right there.
And also
Claremont.
The Claremont Hospital, correct. The New Hampshire Hospital Association has put out monthly white papers showing that with the advent of Medicaid expansion, that uncompensated care costs have dropped across the board by as much as 20-25%. And that is saving them money. And especially with Dartmouth being such a big player in District 5, in the economy of District 5 is with the thousands of people that it employs, and of course, the ancillary effects of that. That's a lot of money that they're saving, and so that's a lot of money that's being kept in the community rather than providing. Because before Medicaid expansion, someone who comes in who's uninsured, there's a federal mandate that the hospitals have to treat them whether they can pay or not. And that's what's referred to as uncompensated care. But now with access to insurance, the hospitals are now getting at least something. I mean, as you know, Medicaid rates in New Hampshire are the lowest in the nation.
I was going to say
rates are the lowest in the nation.
The Medicaid, the rates, when I talk to people in the industry, they say, look at, the rates don't begin to cover our costs.
Right, right. But it's better than zero.
That is
right?
true, yeah.
Right. But I think that, if we're looking into the future and, as being now, I guess, an elder statesman, I didn't want to apply that own term to myself, but, that's really something that we need to look at. And the other big issue, of course, is the crisis that's facing the state, is the opioid crisis.
And we're at the beginning of that, I think.
I think so, too. I mean, the number of deaths in 2014 compared to 2015. 2015 was a big jump. We're seeing even more this year in 2016, and it's tearing families apart. It's tearing communities apart. I don't perceive as much of a problem in the Upper Valley on an aggregate scale as we do, of course, the big cities in Manchester and Nashua. But still on the micro level, family by family basis.
If it's your child, if it's your parent,
exactly.
If it's your neighbor, if it's a friend, it's an issue.
It's an absolute issue and can tear communities and families apart.
We've got about 30 seconds left, so we may have to come back to this issue. But on the balance of interdiction versus treatment, does the state generally have the policy right?
I think we're getting there. We're getting there because you're right. I think prevention, education are absolutely much more effective in combating the crisis. As a problem, as a whole problem.
Treat it medical versus criminal.
And there's that issue as well. I think that's another facet of things. But prevention and education rather than treatment. But if you don't have the first, then let's put some money in treatment as well. But then also criminalizing the issue versus educating the issue is better.
So let's stop here. We're going to have to talk about it. And when we return, we will continue our conversation focusing on this issue. So please stay with us.